Today I'm going to be doing a head-to-toe assessment of a newborn. I'll begin with hand hygiene. After hand hygiene, I'm going to ensure that my hands are warm and dry along with my stethoscope. Before I begin, I do a two-step identification process on the baby to ensure that the baby is with the correct parent, to the correct mother. They might have some identification bands. I'm going to first note the general appearance of the baby, his activity, his muscle tone, his crying, ensure he has a strong, healthy cry. Now I begin with vitals. I'm going to start with the temperature in the armpit here. Typical temperature is 36.5 to 37.2 degrees Celsius. I'm going to assess now the heart rate at the apical pulse. I'm going to listen for a full minute. Typical heart rate is 110 to 160 beats per minute. I'm now going to take the pulse ox. Typical oxygen percentage I'm going to be looking for is 95 to 100%. I'll take BP here at the upper femur, the upper thigh. Typical blood pressure is 50 to 70 diastolic over 30 to 45 diastolic. I'm now going to get some body measurements of the baby. Typical baby weight is 2,500 to 4,000 grams. The length of the baby will be taken from the top of the head to the heel. Typical length is 48 to 52 centimeters. The head circumference is going to be from the eyebrows around the occipital. Typical head circumference is 32 to 37 centimeters. The chest as well, take that around the nipple line to the lower edge of the scapula. Typical chest circumference is 30 to 35 centimeters. With my stethoscope now, I'm going to listen to the lungs. I'm going to listen in all the lobes. Making sure I don't hear any advantageous lung sounds such as crackles or wheezing. I'm also making sure that the baby's respiration rate is between 30 and 60 breaths per minute. I'm now going to listen to all the abdomen fields, quadrants. Making sure I hear active bowels in all the quadrants. I'm now going to begin my head to toe. I'm going to start at the head. I'm going to note the general appearance of the head. I'm making sure that I don't see any cephalohematomas. I'm going to palpate the anterior fontanelle, making sure that it is soft and firm. I'm going to palpate the sutures, making sure there's no extensive gap. Overlapping may be normal. Anterior fontanelle is diamond shaped. Posterior fontanelle is triangular shaped. Next, I'm going to move to the ears. The ears should be in a straight line from the outer eye canthus to the top of the ear. In Mickey's case, his ears are up here. Next, I'm going to assess the eyes. With the pen light, I'm going to test the coronal reflex to make sure that the light is reflected symmetrically in both eyes and that the pupils react to light. I'm going to check the sclera of the baby to ensure that there is no jaundice or signs of hemorrhage. There may be the presence of epicanthal folds here in the eye. These may be consistent with ethnic backgrounds or with Down syndrome. I'm going to assess the nose. Very important to assess patency. I'm going to start by giving the baby a pacifier, and I'm going to occlude one nair. I'm going to note chest and abdomen rise and fall. Occlude the second nair. Note chest and abdomen rise and fall. I'm going to take the pacifier out, and I'm now going to assess the mouth. For the mouth, I'm going to first try the sucking reflex with my finger in, and if he sucks on it, that shows an intact reflex. I'm going to inspect the mouth to see that there are no lesions or holes in the mouth, that the hard palate and soft palate are developed. Next, I'm going to check the neck. Babies have a short neck with a lot of skin folds. As you can see, here's where I'll palpate to see if they have any enlarged nodes. Next, I'm going to palpate the clavicles to ensure that there are no fractures during birth. While I'm here, I'm going to check the extremity range of motion. I'm going to check the chest, ensure that the chest shape is symmetrical and round, and that the nipple should be even. I'm going to assess the abdomen. I'm going to palpate in all 4 quadrants. This will assure that there are no masses or identify any masses. I'm going to note the shape and contour. The abdomen should be round and slightly protruding, even above the chest. This is normal. I'm going to assess the umbilical cord. I'm going to make sure that there are 3 vessels, and I'm going to examine the umbilical cord to note any signs of infection. Next, I'm going to move on to the legs. I'm going to make sure the legs are equal length, knees are equal height. I'm going to now begin with a Ortolani and Barlow's exam. Ortolani, with your fingers here at the femoral head, you abduct the leg. If you hear clicking, that's a abnormal finding. Same with here. Next, you do Barlow's exam. You adduct the hips and do posterior pressure. And if it clicks, that's another abnormal finding. I could check the fat folds to make sure that they're symmetrical. Here I'll assess the color of the legs. Maybe I'll find acrocyanosis. This could be a normal finding. Next, I'm going to look at the feet. I'm going to count the toes and look for clubfoot. I'm going to check the hands, count the fingers. I'm going to check for the palmar crease. And I'm going to check for symmetry and range of motion in the extremities again. For the genitals, if it was a female, I would check to make sure that the labia majora covers the labia minori. And I would check to make sure it's not edematous. The labia is not edematous. For male, I would check that the urinary meatus is central, it's not high or low. Make sure that the testes are descended and that the testes are not fluid filled. Now we'll flip the baby over to a spine. Over to a prone position, excuse me. I'm going to run my fingers down his spine. And make sure the dimple here is closed. I'm running my fingers down his spine to assure the presence of all the vertebrae. And make sure the skin is smooth. While I'm here, I'm going to check the patency of the anus so that the baby will be able to pass stool. Now I'm going to check skin turgor and show that the skin snaps back right away, which shows adequate hydration. I could assess for jaundice by putting the baby up to natural light, which is easier to identify the natural color of jaundice. Next, I'm going to assess the pulses. Start with femoral. I'm going to assess that the pulses are present, that they're regular, and that they're symmetrical. I'm going to check now the brachial, that the pulse is present and regular and symmetrical. Great. Now we're going to begin with reflexes. Earlier we did the sucking reflex, where the baby sucked on my finger. Now we're going to do the swallowing reflex, usually during feeding or give the baby some fluid and see if they swallow properly. Next, we'll do the palmar reflex. You put your hand here and Mickey should grasp it, indicating intact reflexes. Same thing here for plantar. You put your finger at the base of the toes and you watch as the toes curl in your hands. You can assess the Babinski reflex by running your finger up the toes, up the sole, sorry. And if the toes fan out, that's a normal finding in infants. Once again, your finger up the heel and the sole of the foot, toes fan out. Next is the rooting reflex. So I'm going to touch the newborn's cheek, and the newborn should turn its head to try and essentially suck on my finger. Do it both sides. It should turn to try to suck on my finger. This may change if the baby's not hungry, or just may be influenced by the baby not being hungry. Next is the tonic neck reflex, is where you place the infant supine like this, and you turn the baby's head to one side, and the extremity on that side should extend, and the extremity opposite side should flex. Should like bend, like that. Same thing on the other side. Finally, it's the startle reflex. We can do this several ways, but the way I'm going to do it is we're going to just slightly drop the infant and catch him. The arm should flare up and try to reach out. So such like this. Maybe again. And the baby's arm should reach out. Okay, while we're here, we're going to assess capillary refill on all extremities. Capillary refill should be 2 to 3 seconds. After the assessment, we're going to make the baby warm again, cover him or her up, and make sure they're in a safe position, and then we're going to return them to the parents.